If everyone can take a seat, we'll get started. For those who don't know me, I'm Carrie Ernst. I'm the AOA counselor for our Lambda chapter here at Sinai. So each year we invite a visiting professor to spend an entire day with the AOA students around the induction day activities. And while our visiting professor is someone who is nationally recognized as a leader in teaching, service, research, and/or patient care, above all, he or she serves as an exceptional role model to the students. And this year we are truly honored to have Dr. Charlie Clement join us as our 2012 AOA visiting professor. Dr. Clements is a well-known human rights activist and public health physician. He currently serves as the executive director of the Carr Center for Human Rights Policy and an adjunct lecturer in public policy at the Harvard Kennedy School. He is also a faculty member of the Harvard Humanitarian Initiative. Dr. Clements received a Bachelor's of Science degree in economics as a distinguished graduate from the United States Air Force Academy and went on to receive a master's degree in operations management at UCLA. In 1985, the New York Times wrote about him that his story is that of one man's more or less gradual discovery of his own identity, including his own politics. Initially an enthusiastic supporter of the Vietnam War, he went overseas as a pilot. And after 9 months as a pilot in Southeast Asia and more than 50 missions, he concluded that war was immoral and refused to fly further missions. He subsequently returned to the United States and pursued an MD and PhD degree from the University of Washington. As a newly trained physician, he devoted a decade of his life to the civil war in El Salvador, which included caring for civilian patients in rebel-held territories there. Witness to War, an accounting of that experience, was published in 1984 and has also been the subject of an Academy Award-winning documentary by the same name. In that era, he co-founded and led the Salvadoran Medical Relief Fund, as well as a political action committee called Pax Americas. He led a number of congressional fact-finding missions to Central America during the 1980s and was a special guest at the signing of the peace accords that ended the war in 1992. Dr. Clements was one of the founding board members of Physicians for Human Rights, which he represented at both the treaty signing and the Nobel Prize ceremonies for the international campaign to ban landmines in 1997. Following years of additional service in human rights work, Dr. Clements went on to serve as president and CEO of Unitarian Universalist Service Committee, a Cambridge-based human rights organization, until becoming the executive director of the Carr Center in 2010. Dr. Clements has been widely recognized for his humanitarian work, and we are thrilled to have him as our grand round speaker today. Thank you, Dr. Clements.
Thank you, Carrie, for that thorough and generous introduction. It's my pleasure to be here with you today, and I'd like to thank my friend and colleague, Holly Atkinson. I think she nominated me for this opportunity. And you may remember that about this time a year ago, you had a medical education grand rounds on health, human rights, and advocacy. And Holly did not put me up to this at all. She asked me what I would like to talk about, and I said, well, what I'd really like to talk about is why I believe that human rights education should be part of every core curriculum, not just an elective. And so that's kind of the basis of what I'm going to talk about today. Before I do that, though, I should, in the spirit of full disclosure, since Carrie revealed my dilemma of refusing to fly in the war, I was put in a psychiatric ward, and I stayed there 6 months, and I was discharged with a 10% mental disability. So I'm incapacitated according to the U.S. military, but I figured out that same piece of paper implied I was 90% intact, and that's the part I took to medical school and went on. So I'd like to provide an overview of the global human rights framework today, and I know that'll be redundant for some of you who are familiar with that, but I find most Americans really aren't familiar with it, don't understand kind of the reach of this global human rights framework. And then I'd like to place in context some of the gains that have been catalyzed by the human rights approach and that framework, and finally plant some seeds as to why a basic course in human rights should be part of the core curriculum rather than an elective in the curriculum at Mount Sinai Medical School. So, and then possibly, I want to protect you from this frightening-looking figure over here, which is often called death by PowerPoint at the Kennedy School, and we'll try to keep it moving along. So the Global Human Rights Framework begins with the Universal Declaration of Human Rights, articulated on December 10th, 1948, voted on by the fledgling United Nations. 48 nations voted in favor of it. There were 8 abstentions, so there were only 56 nations at the table. most of the so-called colonies of the world weren't at the table. And when Eleanor Roosevelt spoke just after, at 3 o'clock in the morning, when this passed, she said that she hoped this would become the modern Magna Carta. And I think that you'll see it's gone a long ways toward doing that. It is followed by the International Bill of Rights, which is known as the International Covenant on Civil and Political Rights, and the International Covenant on Cultural, Economic, and Social Rights. Those two conventions, two treaties, are kind of the bulwark, and with the UDHR are often called the International Bill of Rights. And following those two conventions, which were finally finished in the 1960s and entered force in the 1970s, we have over 20 human rights conventions which have flowed from the UDHR. So the Convention Against Torture, the Convention Against the Elimination of All Forms of Discrimination Against Women, commonly known as CEDAW, the Convention to Ban Landmines, the Convention on the Rights of the Children, the Convention on People with Disabilities. Many Americans are really unfamiliar with these treaties and unfamiliar with the impact they're having in the world, but take the Convention on the Rights of the Child. When a convention is brought before the body who elaborated it, nations are given a chance to sign it, and often the President sends a signal to sign the treaty. The treaty is then taken back to their Parliament, in the case our Senate, and it's ratified. And when it's ratified, they are required to amend their domestic law to be consistent with it or file exceptions. In most countries, just incorporate it into domestic law. So the Convention on the Rights of the Child has been ratified by 190 of the 193 nations in the United Nations system, far more than any other treaty, and thus becomes kind of an international morality of sorts, because the world's communist nations have signed it, the world's capitalist nations have signed it, all of the nations in the north except for one, most of the nations in the south except for one, most of the predominantly Muslim states, the world's only Jewish state. It really becomes an international morality of sort when everybody agrees this is the body of rights to which all children are entitled. One of the last treaties that came into effect was the treaty that established the Rome Court in the late 1990s. And the ICC now is a place where crimes against humanity, war crimes, and serious crimes of many natures can be adjudicated. It's still getting its feet on the ground. It came into effect in 2002. And finally, we have the regional human rights systems, conventions, and courts. So the earliest was the European Court of Human Rights and the European Convention on Human Rights, which have really been in the forefront of human rights in the last 40 years, in the vanguard, you might say. The more recent African Charter on Peoples and Human Rights, the American Commission on Human Rights, and there's also an American Convention on Human Rights, and the newest addition to this, the ASEAN Commission on Human Rights, and I think that it will elaborate a convention on human rights in the very near future. The European Court of Human Rights has become an incredibly powerful mechanism, largely because of the economic incentives to join the European Union. So Holly and I, at Physicians for Human Rights, worked on the issue of torture in Turkey for a number of years, and torture was endemic. Everyone was tortured who went to prison. Drug dealers, suspected political operatives, journalists, anyone who was jailed in Turkey was tortured. Physicians there started treating clandestinely people who were tortured, treated them, and then finally set up clinics. There were so many of them whose lives were just broken, and the state accused them of defaming the Turkish people, and took them to trial, took the Turkish Medical Association, equivalent to the AMA, to court and convicted a number of physicians for this offense. So Turkey was so embedded in torture that we never thought it would go away. And it ended almost overnight when Turkey decided to accede and apply for admission to the European Union, because it had to sign not only the European Convention on Human Rights, it also had to agree to unannounced inspections of its prisons with prisoners meeting with the delegations. And within about 2 years, torture had just about entirely diminished in Turkey. And so the impact of all the new nations joining the European Union having to sign on to the Commission has become a very powerful force. And then finally, there's the UN Human Rights Council, the UN High Commissioner for Human Rights, things like the Universal Periodic Review. You may not be familiar with the UPR, but it's something that the Council enacted a few years ago that requires every nation in the United Nations to come before the Human Rights Council and report on its advances in human rights, report on its deficiencies, and present a plan for remedying them. At the same time, it allows civil society in each of those countries to also report in that and to hold the governments accountable in a very public forum. It was very ironic that when the U.S. came up, and every country comes up every 4 years, when the U.S. came up in 2010, that we had the former dean of the Yale Law School, Harold Koh, and we had the founder of Human Rights First, Michael Posner, defending the U.S., and there were detractors like Cuba and Ecuador and others challenging the U.S. Detention in Guantanamo, questioning the secret detention centers that we had around the world. And these two stalwart human rights activists who have been in the forefront of human rights activists were now in government and having to defend our government against these human rights practices, which they, as practitioners, had really railed about themselves. But it was quite a moment, and it is beginning to have some impact as countries don't like to be held accountable in public. And finally, there's the National Human Rights Commissions, ombudsmen, and courts that are also having an impact in interpreting many of these conventions locally for the national sake. International NGOs like the ILO, UNICEF are terribly important in this whole spectrum as well as NGOs like Human Rights Watch or Amnesty International and Physicians for Human Rights. And finally, we need to include foundations in this who make much of this work possible. Certainly that in the era that when the modern human rights regime was established, largely by what was happening in Argentina with the Dirty War, the Ford Foundation funded that work and made much of that possible and set the human rights framework on its feet. And finally, that was supposed to say corporations. Don't know what happened to that slide, but corporations are playing an increasingly important role. You may not know that Western Union contributed $50 million last year to immigrants' rights projects because most of their money is made from remittances that immigrants send back to their home countries. And corporations are playing an increasingly important role, not by giving to foundations, but by giving money directly to things that they think are important and consistent with their operational mission. So, what will be the significant gains in human health in the coming decades? I think in the 19th century, we can say that a lot of the gains came through public health. In the 20th century, I think that we saw that scientific advances had a lot to do with it. And I would posit that in the 21st century, some of the most significant gains in public health will come as a result of human rights advocacy. And I'll explore some of the recent achievements that make me believe that. I'm going to trace a little bit the history of the human right to water and sanitation. It really began in some ways in Cochabamba, Bolivia in 1999 when this town wanted to revise its aging water system, and the World Bank said, no, we're not going to give you the money to do that, but if you privatize your system, we'll loan the company you privatize it to the $8 million you want. They privatized it to Bechtel. Bechtel came into town, tripled the water rates to about 300% right away, which people tolerated, but when they said that the water that fell from the skies and was collected in cisterns, and the water that was collected in wells belonged to Bechtel, the largely indigenous population rebelled. There was about a year-long standoff between the military, civil disturbances. One young man was shot in the forehead by a sniper and died. And finally, Bechtel left town, sued Cochabamba in the World Trade Organization court for the contract they had, not for lost profits, but for lost anticipated profits. Sued this very poor city for $25 million and was awarded finally 2 bolivars, about 65 cents. In an admission that maybe legally they were right, but morally they were wrong. And this led to the Declaration of Cochabamba when people from around the world came there to celebrate and make a statement about the human right to water. That led shortly afterwards to the treaty body. Each convention that's passed has a body that oversees its implementation. The treaty body for the Convention on Economic, Social, and Cultural Rights, in a general comment, affirmed that there was a right to water in international law. And then our next major step was in 2008 when the High Court of South Africa found the installation of prepaid water meters illegal under the nation's constitution, which guaranteed the human right to water, and ordered the city and water authorities to increase the basic free allotment of water to 50 liters per day, the amount consistent with human dignity according to the World Health Organization. And finally, in 2010, the General Assembly recognized the human right to water. And these are milestones that have long stories behind each of them, but I'm going to tell you a little bit about this one because I was involved directly in this case in a community called Piri, which is part of Soweto, one of the so-called townships in South Africa. And a number of women had been protesting the policies of the Johannesburg Water Company for many years, almost 10 years, without any effect at all. And they were protesting a couple of things. One, that the water company was giving an allocation of water per household, ignoring how many people might be in that household. They were giving them 6,000 liters or 6 kiloliters. And that really amounted to, in the average household there of 16 people, enough to flush the water once every 2 days, have a body wash once every 4 days, and leaving very little for drinking, cooking, cleaning. And then they put a water meter on the house so that when that 6,000 liters was used up, to get any more water, they had to put coins in the meter. So if you had an emergency of any kind, if you had a fire in the home, if you had a child with diarrhea, you had to put coins in the meter to get more water, and many households have a high rate of unemployment and didn't have anybody that could do that. So they finally, after civil disobedience, after a number of campaigns, 5 women took the Johannesburg Water Company to court, and that's where the NGO I led came in. We had a legal strategy to help people around the world who were pressing for the human right to water, help them develop a legal strategy to do so. The Constitution, promulgated under Nelson Mandela, did say there was a human right to water, but didn't define it. And so the court finally ruled in their favor, said that there was a human right to water, and the water company had been saying that we only wanted to provide 20 liters per person. The World Health Organization estimates that it takes 25 liters per person to meet our basic needs for sanitation, cooking, and hygiene. But it says that 50 liters is the amount consistent with human dignity, and the court awarded them the amount of water consistent with human dignity. So that was a victory heard around the world, especially in communities around the world that had been challenging their own governments about the human right to water. So in Holly's PowerPoint presentation, she talked about students hungering for human rights. They search for these frameworks, and they find it in human rights. And I think we found that in a number of cases. And I often have students ask me, and they say, well, you know, if the United Nations and if these idealistic people around the world create these conventions that we've seldom even heard of in the United States, how do they have any impact, and do they really have any impact? CEDAW is something most people in the United States are not very familiar with, the Convention to Eliminate Discrimination of All Forms Against Women. And yet around the world, it's really held as a beacon of hope. And I think Colombia is one of the places where I often use to illustrate what one of these conventions can do, because they're basically tools for advocacy. Colombia has been known to be a very conservative country, one of the most conservative Catholic countries in the hemisphere, and have a public bureaucracy that's not terribly responsive. And in 1982, the president of Colombia, perhaps pressured by his wife, said, let's sign this convention. And then the politicians, largely male, trying to be deferential to the ladies, as they said, decided that they would try to ratify it in the Congress, and did ratify it, not knowing actually what would be done with it by Colombian women. So there was a local affiliate of International Planned Parenthood there called Pro Familia, and immediately after the passage of CEDAW, they started a series of legal services for women that had 2 objectives. They wanted to use and publicize the ratification of CEDAW as a means to improve the condition and secure equal access to family planning services. And they also wanted to publicize the new rights for women in the family environment by means of educational material and direct personalized legal orientation. Now, 70% of the population of Colombia lives in 5 cities, and so they were able to reach enormous numbers of people by setting these services up in urban settings. And the Constitution of Colombia really favored the rural areas, and the president, presidents for some 20 years had been trying to shift the balance of power toward the urban areas, and finally was able to do so despite the Congress by calling a constitutional assembly, which the women of Colombia saw as a great opportunity to mobilize on their own behalf. So the Women's Network for Sexual and Reproductive Rights, a coalition of some 20 women's organizations, seized on CEDAW to make a series of proposals designed to advance women's social and legal standing. They wielded CEDAW as a mandate because it was adopted into domestic law when it was ratified. And so they said, these are international human rights that we are entitled to as citizens of Colombia. They really inserted the rights of CEDAW into almost every clause in the Constitution. So Article 13 ensures women's equality. Article 42 directly addresses violence in the family. Article 42 addresses women's health and reproductive autonomy. Articles 91 and 94 import all international human rights treaties which Colombia had ratified. And so everything, all of those 20 treaties I mentioned, all of them that Colombia had ratified, now entered domestic law automatically with the new Constitution, which was an achievement really of the women of Colombia. So how did they succeed in this patriarchal and Catholic country in doing this? They did it educating women about their rights and mobilizing them to respond to this moment. Another important piece of this that has meant that these rights were actually respected was they inserted something in the Constitution called a tutela, which is kind of a legal aid obligation of the state to respond to a writ. And these rose from 10,000 in 1992, the year after the Constitution was promulgated, to 141,000 in 2002, and many of these were giving women redress to the rights that were promised them in the Constitution and CEDAW. So this is a great example of how these conventions can be used to advance rights, and there are, of course, numerous of these around the world. Campaign to ban landmines was something that I was fortunate to be involved with. I had served as a family physician, as Carrie mentioned, in El Salvador, and often had people brought to me carried 5-6 hours on a stretcher who had been harmed by a landmine that cost $2 or $3 to make, but permanently would maim them. And the International Campaign to Ban Landmines began in 1990 with a group of 6 NGOs. They eventually expanded to include 6 NGOs from the south as well as the 6 from the north. Physicians for Human Rights was one of the founders of that campaign. When we sat around early in the stage of that campaign, we said, you know, we need to be prepared to be here for 25 years because it may take that long this may be like the civil rights movement, where we're really looked at as radicals in the very beginning and then finally kind of accepted and then begin to build some momentum, but all of that takes time. But within 7 years, we had built a momentum and crafted a treaty that was signed by 121 nations, and the Nobel Peace Prize was awarded to the campaign that year, not for a lifetime of work, but because we had created a new form of citizen diplomacy. This was the first arms control treaty led by civilians. The treaty entered force in 2009. The convention said that 60 nations had to ratify it before it entered force legally. It entered force at that time faster than any other treaty in history. So it's now a little over 10 years old, and we look back on those 10 years and kind of see what's happened. And there has been the beginning of a paradigm shift, for one thing, in the sense that mines were used by all militaries in the world but 2 in 1990, and now they're used by very few. The Landmines Monitor can identify only 2 that were known to be using landmines in 2009, so down from 15 in 1999. More than 50 states used to produce landmines. 38 states have ceased production of landmines. The United States, China, and Russia still produce landmines. Each country does, but they've also passed domestic legislation banning their export, which shows how much countries that are even outliers don't want to be seen as outliers when there's such a paradigm shift as this. 44 million stockpile mines have been destroyed, including the last 1.6 million in 1 year. And of the 149, of the 156 parties to the treaty now do not have stockpiles. They've destroyed them all. The U.S. had to remove its stockpiles from NATO countries because many of our NATO allies had U.S. mines on our military bases in Europe, and they said you had to get rid of them. And 4 countries that are not even party to the treaty have also destroyed their stockpiles. Again, showing, you know, it was Lewis Hinken at Columbia University, the famous legal theorist, who said that most countries obey most international laws most of the time. And this really is an example of that dictum. And finally, the casualties have dropped from around 39,000 a year in 1997 to less than 5,000 a year. Still too many, but it's a remarkable achievement and one of many. So this is a chart that Holly showed you, the links between health and human rights, which are numerous, and there's probably not a portion of human rights that you can identify that doesn't have a serious impact on human health in one way or another. Why physicians? Well, we have a primary ethical and responsibility to the health of the community. We're important witnesses to socioeconomic determinants of health, and we can provide evidence, information, and professional authority to bring legitimacy to these claims. And most physicians' organizations articulate this obligation in their mission statements. So I think that human rights are one of the key forces shaping the world today. I think both legally and politically. And the Human Rights Framework articulates a vision of justice and fairness in the operation of states and communities, and this language is increasingly being used. You heard it used throughout the Arab Spring. I think you can hear it used in all corners of the world. And I think that it is a force that is extant in virtually every corner of the world today. A recent New York Times article that probably some of you saw and caught my attention mentioned that the world's democracies are on average much less similar, their constitutions, to ours today. In 1945, just before the UDHR was promulgated, most of the world's constitutions looked very similar to ours. Increasingly, ours is not looked at as a model, largely because we are not very cognizant of human rights in our Constitution. And there's a number of reasons for this that is not being used. One is that it's terse and old, very hard to amend. Professor Law said one of the central reasons was that nobody wants to copy Windows 3.1 when there's much newer editions available. A former or a justice of the High Court of Australia said America's in danger of becoming a legal backwater. And finally, a president of the Supreme Court of Israel said the Canadian law serves as a source of inspiration for many countries around the world. And the Canadian Charter of Rights and Freedoms, adopted in 1982, is much more influential today than its American counterpart. I mention this because I think we are in danger of becoming a backwater also in our own minds, that we aren't aware of the fact that, that the world is passing us by in this regard. Jonathan Mann reminded us that human rights are ultimately about human well-being and is the province of every physician, who shouldn't be excluded from this powerful discourse that's a force for change in every corner of the world, except too seldomly our own. I'm going to close with a quote that I think illustrates this. When the debate over whether we should continue to try adolescents and hold them in jail until they were 18 and then execute them, which was an orchestrated campaign by human rights organizations to win 4 or 5 states that were still doing that and then take it to the Supreme Court. And when it finally got to the Supreme Court, one of the plaintiffs suggested that the United States was the last country in the world doing this. The last country. Everybody else believed in adolescent heart and adolescent mind were works in progress. If they committed a heinous crime, it's because they were failed by the adults around them and their life shouldn't be taken from them. We'd like to keep them in jail till they're 18 and then execute them. And Justice Scalia said, what do we care what the rest of the world thinks or does? In a famous retort. And I think that as we're sending medical students around the world, as our patients come from around the world, and increasingly it's a globalized world, we need to understand the force of human rights, what they represent, and the hopes that they represent globally. So thank you.